Hello, my name is Tyree Cisco, and today I'll be speaking to you about the disease called lupus. What is lupus? Lupus is a chronic autoimmune disease which deals with the body's immune system attacking the good cells and tissue. The immune system is made up of white blood cells that defend your body from any type of invaders. These invaders would be bacteria that get into the body system of the white blood cells. But these white blood cells will identify the body's other white blood cells for any type of bacteria that they think it is. In all actuality, they're fighting off against each other. What is autoimmune? Dealing with an autoimmune disease such as lupus, white blood cells mistake their antibodies that they make to be good cells, in which antibodies cause them to destruct them. Basically, it's saying they destruct their own cells. White blood cells come in contact with other white blood cells and they're killing each other off because they don't understand that they're white blood cells. They think they're viruses. So now we have, they attack normally. All right, next slide, please. What is lupus? Oh, I already went to that. What causes lupus? Nothing really causes lupus except they don't have a key thing that causes lupus, no drugs or anything, but they say that the sunlight can cause lupus, bacteria, viruses, infections, medications, diet and stress. You just need to take care of your body. If it's in your genetics, it's from your genetics. They really don't know where lupus originated from. It's just in your genetics. So next, who has lupus? 9 times out of 10, 90% of females have lupus and only about 10% have lupus. The females age from the ranges of 15 to 45 years of age in all cultures: white, black, African American, Caucasian, Spanish. And males is also the same all around the United States. Not everybody, but most people, 9 times out of 10, 1 out of every 10 males have lupus. And yeah, so the ratio is really small for the males, but the females is really high because it's just more so when females are young in age, they tend to get it around 15 through 21. Normally when they're giving birth, they start coming in with the issues of having lupus. There are 3 types of lupus. The first type is systematic lupus erythematosus, which is the most powerful of the disease and gives you all of the kidney problems, the breathing problems, the heart tightening up, all of the body aching, the skin pilling, all of that. Just chronic lupus is the type of lupus that only deals with really rashes that come along your face. It's like a butterfly effect. You get all of this with lupus, all filled with red rashes, and then sometimes you can get them in your mouth and lesions and stuff from the disorder or whatever. So, and the last one that's really a big deal is drugs. Certain drugs that people take, their body that aren't used to those drugs, during heart surgeries and brain surgeries, and the doctor gives you medication to stay well, but you can't really stay well because the medication that they give you is really creating your body, making your body immune system fight back against your immune system. So technically you really won't be getting well, you'll just be getting worse. The diagnostics for lupus really doesn't have a special test for it. It's just, it is normally said to be, it takes up to 2 or 3 years to actually figure out that you have the lupus. It's a string of many diseases that have like the same effects on it, but to break it down into one specific, there's no specific test. It's like an ANA test, which is the only, well, it's not the only test, but it's the best test that they use to identify your lupus. After your doctors and all run a lot more tests. Okay, that's the diagnostics. Now males normally only are 10% of the lupus population until you get to about the age of 50. Then it switches to like 25% of males out of the 100 that have lupus. And most of the time, you're like born with it. Well, you're like born with it, but you don't know you have it. But in most males, it comes out when you're either really, really young, like from an infant to the age of 8, or around your older ages like 35 and 40. So yeah, it's really not really found in males that often, I guess, because our bodies are set up differently than females' bodies, but they say it's different, and females always get it more. So now we have a chart. This chart shows you slide A over there to the right. I don't know if I'm pointing at it. It's the disorders that I just went over. The dyschronic facial lesions. There's some facial lesions and all the rashes on your skin and stuff. And part B, picture B shows how your joints and stuff get really tight, your muscles swell on a little kid, like they're little boys, so they're little males. So they got it at the age of like 2 or 3. I don't really know the exact ages of them. And then the next one is just showing your cell and how chronically it's fighting against each other. It's really good to see under the telescope, so you can see it actually moving. Like that picture is really not a good picture. And then the last two, they identify the imoxy. I don't really know how to pronounce that word correctly, but yeah, I'll explain that further in my paper. And here I have a little video that explains the new disease the new treatments they have for the disease. It's really great.
It's actually exciting news coming out of GlaxoSmithKline. They're promising early release there on a new drug called Lupus. They succeeded in the second big clinical trial, raises the chances that this new medicine will potentially become the first new treatment for lupus that's been out in almost 40 years. So that's very exciting.
Because some of the current medications are really strong, and they help the symptoms, but they also suppress the immune system, they can more prone infections. So something new on the horizon. Right?
Well, you hit the nail on the head. The way you treat lupus is you try to shut your immune system down, because your immune system is attacking your own healthy tissues. So we give steroids amongst other medicines that suppress our immune system. So if we get an infection, or if you get an infection on these immune suppressors, you can really have a difficult course.
And there you have they were speaking on the new treatment they have for the disease that is really better than the ones that they have out now, because the ones they have out now really affect the body really harmfully. It's like chemo and stuff, and it's really not good. It really hurts and harms your body, and all the inflammation of the cells and lesions. Right here are some of the different types of treatments. And so it's physical, emotional stress, rest, medication, Crohn's, healthy diet, stuff like that. It's really good. Can this disease be spread? No, this disease cannot be spread, because it's not like an STD. You don't just go touch somebody and you just have it. It's just something in your genetics that's generally made up. They don't really have an answer for it either, so I really don't have a clear answer on that. Okay. Any questions or answers about my presentation? Maybe, maybe not. All right, here's my works cited, and thank you guys for listening to my presentation. Hurry up.